when the body sends a distress signal. If you could turn back time just 3 minutes, what would you do to save the one you love most? One early morning, everything seemed peaceful. The sun had just risen, birds chirping, breakfast being prepared. Then suddenly, Mrs. Eva, 68 years old, a devoted mother and loving wife, collapsed on the kitchen floor. The glass in her hand dropped. Her eyes went blank. One side of her face drooped. She couldn't speak. Her husband, Mr. Peter, thought she was just feeling faint and helped her lie down. But 2 hours later, she was in the emergency room, diagnosed with a stroke. Mrs. Eva was healthy, not obese, didn't smoke, ate well. So why? The painful answer is, her body had sent warning signals, but no one recognized them. Direct It, this isn't just a story. It's a wake-up call for millions of elderly people. Did you know, every 45 seconds, someone has a stroke worldwide, and every 3 minutes, someone dies from it? Over 70% of them are over 60. But here's what's more terrifying. 80% of strokes are preventable if caught early. The problem is early signs are often quiet, just a bit of slurred speech, a few seconds of dizziness, a moment of confusion while cooking. People think it's normal, just tired, just age. And then, one day, there's no turning back. Studio Microphone, in today's video, we'll explore the earliest signs of stroke in the elderly, often ignored. How to tell stroke apart from other common symptoms. Real cases of near death due to carelessness. And how to act quickly to save yourself or a loved one. Brain, don't let a stroke take everything when you can recognize it early. Let your heart be warned before it's too late. Let's begin with the first part. What is a stroke? And why is it especially dangerous for the elderly? Dear viewer, we often hear the word stroke, but how many truly understand it? Many think it means someone suddenly collapses, unconscious, face drooping, limbs twitching. But not all strokes are dramatic. Some are silent, no falls, no seizures. Yet with a blink, a part of the brain dies. Brain, what is a stroke? It's when blood flow to the brain is blocked, causing brain cells to die within minutes. The brain is only 2% of body weight, but consumes over 20% of total oxygen. A 5-minute blood supply cutoff can cause permanent brain damage. And unlike skin, the brain doesn't regenerate. Once damaged, memory, speech, movement may never return. Types of stroke. Direct It, 2 main types. Ischemic stroke, 85%. A blood clot blocks blood flow to the brain. Brain cells suffocate and die paralysis, facial droop, coma. White heavy check mark if detected early. Clot-busting drugs can save the patient during the golden hour. Hemorrhagic stroke, 15%. A blood vessel in the brain bursts, bleeding pressure on brain swelling death. Warning, this type is often more fatal, especially if bleeding occurs in the brainstem. Why are the elderly more vulnerable? With age, arteries stiffen, blood pressure constantly pushing against weak walls like old pipes leaking. A sudden blood pressure spike can be the last straw. Elderly people often have hypertension, diabetes, high cholesterol, heart disease. These conditions cause clots or vessel damage. Consequences of stroke. Studio Microphone, imagine a city losing all power. Lights out, elevators stuck, phones dead. That's the brain without blood. If the speech center is hit, you can't speak. If the motor area is hit, you're paralyzed. If memory center is hit, you forget loved ones, or even yourself. Bar chart, scary statistics. 1/3 of stroke patients die within the first year. 1/4 are completely dependent. 80% never return to normal life. But here's the good news. Sparkle's 80% of strokes are preventable. Sparkle's 90% show warning signs 1 to 2 days in advance. But we don't notice. We think, Grandpa stuttered because he's old. Grandma's walking wobbly because she didn't sleep well. Uncle was confused because he skipped dinner. Studio Microphone, and then 1 day later, we're calling an ambulance in tears. Next, earliest warning signs of stroke in the elderly. Studio Microphone, in the saddest stories I've heard, one thing repeats. If only I had noticed. If only I didn't brush it off as fatigue. If we got to the hospital an hour earlier, they might still be here. Strokes are never truly sudden. The body always warns us first. The question is, do we understand? Direct hit stroke signs aren't always dramatic like in movies. Not everyone collapses, slurs, or faints. Some signs are very subtle. But if you're over 60 or caring for someone who is, remember these. White heavy check mark, fast. 4-step stroke detection. F, face. Ask them to smile. Back and index pointing right, one side droops. Crooked smile. Can't lift one cheek. Studio microphone, this suggests facial motor stroke. Arms. Ask them to raise both arms. Back and index pointing right, one arm weak. Drops down. Studio microphone, a sign of brain motor damage. S, speech. Ask them to say, it's a beautiful day. Backhand index pointing right, slurred. Jumbled. Wrong words. Studio microphone, this indicates language center damage. Tea time. Alarm clock, if any sign appears. Call an ambulance immediately. Don't wait to see if it passes. Every minute equals 1.9 million brain cells lost. Magnifying glass tilted right, lesser known but dangerous signs. These may appear hours or days before fast. Sudden blurry or one-eye vision loss. Like a film over the eye. May see shadows, glare, or flashes. Back-end index pointing right may be mistaken for eye fatigue, but it's a sign of posterior brain ischemia. Temporary imbalance or unsteady walk. Sudden dizziness, almost falling. Studio microphone may signal cerebellar stroke, the balance control center. Numbness or weakness on one side. Face, arm, or leg loses sensation. Back and index pointing right. If someone can't feel hot/cold in one hand, it's a warning. Word confusion or misnaming things. Saying cake instead of knife. Losing track mid-sentence. Studio microphone, early sign of language center stroke. Severe, sudden, unexplained headache. Like a hammer blow, possibly with vomiting, blurred vision. Warning may be a brain hemorrhage. Seek emergency care. Pushpin silent strokes in the elderly. No fainting, no collapse, but sudden confusion, forgetfulness. Personality changes, mood swings. Studio microphone, don't dismiss this as just aging. It may be a mild stroke. What should you do? White heavy checkmark, call emergency services. Don't drive yourself. White heavy checkmark, note symptom onset time. Helps doctors decide treatment. White heavy checkmark, no food or drink, not even water. White heavy checkmark, lay the patient on their side if unconscious. White heavy checkmark, prepare medication info, especially for blood pressure, blood thinners, or diabetes. Stroke doesn't arrive like thunder. It starts with a numb hand, a misstep, a wrong word. Understand this, and you might save a life. Warning commonly misread signs. Deadly mistakes for being too subjective. Studio microphone, dear viewer. One heartbreaking truth is many strokes came with warnings. Warnings ignored, not because loved ones didn't care, but because they misunderstood. Exclamation mark, early warning signs, misinterpreted. Family members often think it's just low blood pressure, probably just vertigo. She's old, forgetting things is normal. He's just tired. Rest will help. Studio microphone, and then by the time they return, their parent is paralyzed, face drooping, or unable to speak. Direct hit, why is stroke so often mistaken? Because it's not always intense, not always dramatic. Some strokes are mild, just a brief brain blood flow disruption, then recovery. These are called TIAs, transient ischemic attacks. But if ignored, they're dismissed as nothing. Warning, dangerous misunderstandings. Sudden unsteadiness equals vertigo. Older person stumbles or loses balance, assumed to be inner ear, vestibular issue. But cerebellar strokes can cause the same symptoms. Pushpin, how to tell apart. Vestibular disorder. Constant dizziness, nausea, worsens with head movement. Stroke, sudden imbalance, possibly with speech issues or numbness. Slurred or slow speech equals just aging. If someone suddenly mixes words, slurs, forgets names, dismissed as age-related. But if it lasts just a few hours, then disappears, high chance it was a TIA. Pushpin warning. This means the brain was temporarily starved of blood. Immediate treatment is needed before permanent damage. Neck or shoulder pain equals arthritis. Older people often complain of neck/shoulder pain. Numb hands blamed on spinal degeneration. But did you know? Back and index pointing right, cervical spinal strokes or strokes in brain motor centers can cause identical symptoms. Brain never dismiss new pain in the elderly. Slight blood pressure drop equals normal. Common to blame hunger or heat. But for someone on hypertension meds, if there's fatigue, cold hands, numb lips, may indicate insufficient blood to the brain. Early warning of stroke. Pushpin always check BP plus heart rate plus symptoms. Don't rely on the number alone. Brief confusion equals just memory loss. If someone suddenly forgets familiar names, misplaces items, fails to recognize family, don't say it's just aging. Exclamation mark could be a memory center stroke. The brain was starved briefly. Open book, a typical case. Mrs. W. NASA, 65, previously sharp. One day, she called her daughter that lady, then laughed it off. The family thought she was just tired. That night, she lost consciousness in her sleep, diagnosed with frontal lobe stroke. If they had sought help at the first memory lapse, clot-busting drugs could have saved her brain. Direct It be especially alert to these 3 phrases from elderly loved ones. Small blue diamond. I feel a bit strange, but I'm not sure why. Most common thing elderly say before stroke. Don't ignore vague discomfort. Small blue diamond. I woke up feeling weak on one side. Strokes often happen during sleep or early morning when brain blood flow drops. Small blue diamond. I'm tired, but it's a weird kind of tired. Fatigue from stroke often includes confusion, numbness, or behavior changes. White heavy check mark what to do if you suspect a stroke. Don't leave them at home to rest. Call emergency services immediately. Don't give aspirin unless you know the stroke type. If it's hemorrhagic, it could worsen bleeding. Note the exact time of first symptom, critical for doctors to decide if clot-busting meds can be used. Studio microphone. Stroke doesn't always announce itself with sirens. It may begin with the smallest things we dismiss. A blurred glance, a slightly weak hand, a misnamed word, a sentence that trails off. Studio microphone. Understand it right, and you won't mistake it. Don't mistake it, and it won't be too late. Next up, the golden 5 hours to respond to a stroke. A race against time to save a life. Studio microphone. Dear viewer, there's a rule in medicine. Time is brain. Every minute during a stroke costs you 1.9 million brain cells. Delay by 1 hour, and you could lose decades of life. Hourglass not done, the golden 5 hours. Your only window to save the brain. We have 5 hours from the first symptom to administer clot-busting medication, TPA, rescue brain areas not yet fully damaged, reduce mortality risk by up to 50%, minimize paralysis, memory loss, or speech impairment. Direct It, but over 60% of elderly patients arrive at the hospital too late because they didn't know it was a stroke. Warning what happens in your brain during a stroke. Brain when a blood vessel to the brain is blocked, ischemic stroke. Brain cells lose oxygen and begin to die. After 10 minutes, cells at the core are irreversibly damaged. Around this core is a penumbra, brain cells that can still be saved. Back and index pointing right, these first 5 hours are a fight to save that vulnerable brain tissue. Direct Hit critical actions in the first 5 hours. Identify the exact symptom onset time. Alarm clock e.g. loved one starts slurring at 8:15 a.m. This is the benchmark doctors use for emergency decisions. Pushpin if unclear, e.g. happens during sleep. Doctors may avoid using TPA due to risk of brain bleeding. Call emergency services, e.g. 115. Do not drive it yourself. Ambulances carry blood pressure, sugar, heart rate monitors, oxygen, and emergency support. Most importantly, alert the hospital in advance. Studio microphone. Time is more valuable than gold. Don't waste golden minutes calling relatives, hailing a taxi, or driving yourself. Do not give food or water. Stroke patients often have impaired swallowing without knowing it. Back and index pointing right, giving porridge, ginger tea, or milk can lead to choking, aspiration pneumonia, or even death. Do not give aspirin or blood pressure meds at home. You don't know if it's ischemic or hemorrhagic stroke. If it's bleeding, aspirin will worsen brain hemorrhage. Studio microphone, let doctors decide after a CT or MRI scan. Bring medical records and medication list. Pushpin especially important. Blood pressure meds, heart medication, blood thinners, history of stroke, diabetes, liver/kidney issues. Brain doctors need this to rule out contraindications. Make fast, safe emergency decisions. Open book a real example. Mr. R.L. Roberobin, 74, from the UK. At 6:45 a.m., while on the phone, he suddenly stuttered and went silent. His daughter thought he was just tired, took him to hospital at 8:15 a.m. Doctor said he had a stroke, but he's already 2 hours past the golden window. MRI showed irreversible damage to the penumbra. He was ineligible for TPA, moved to intensive care. 2 weeks later, alive, but paralyzed and unable to speak. Fire had to always be ready for the 5 golden hours. YW checkmark prepare an emergency map for elderly at home. Emergency number, e.g. 115. Name/contact of nearest stroke-ready hospital. Designated person to accompany them. YW checkmark train your whole family, even kids, on the FAST method. YW checkmark post stroke warning signs in your home. Light bulb conclusion. Studio microphone. Stroke is not tomorrow's problem. It's a matter of minutes, seconds, today. One correct action in the first 5 hours can save an entire lifetime. Be the one who knows, so you can save the one you love. Stroke-proof lifestyle. 7 daily habits to keep your brain healthy in old age. Studio microphone. Dear viewer, if the previous section was about stroke emergency response, this part is about something even more important. Don't let the stroke happen at all. Why? Because once a stroke strikes, even if you survive, you may lose something forever. An arm that no longer feels. Eyes that can't express what you mean. A memory that forgets your children. A voice reduced to meaningless sounds. Studio microphone. There's no miracle better than prevention. YW checkmark 7 science-backed habits proven to prevent strokes effectively. 1. Measure blood pressure daily and take it seriously. Stethoscope high blood pressure is the #1 cause of strokes. The scary part? Many people don't even know they have it. Or they know, but ignore it. Direct it what to do. Measure your BP every morning before breakfast. Track readings for 7 days before every doctor visit. Take your meds exactly as prescribed. No skipping, no self-adjusting. Light bulb tip. Post a reminder note. Measure BP on your bathroom mirror or medicine cabinet. 2. Walk at least 30 minutes a day. Man walking, regular walking. Strengthens your heart. Keeps arteries flexible. Boosts brain blood flow. Direct hit studies show walking 30 to 60 minutes a day reduces stroke risk by 27% versus sedentary people. Light bulb treat walking like your daily medication with no side effects. 3. Reduce salt, increase greens. Leafy green, your brain runs on blood, and blood flows through your vessels. Too much salt water retention, higher BP, higher chance of brain vessel rupture. Direct hit who recommends less than 5 g of salt/day, about 1 teaspoon. Avoid packaged processed foods. Eat more vegetables, fruits, and potassium-rich foods, bananas, sweet potatoes. 4. No smoking, limit alcohol. No smoking, smoking narrows and clogs arteries. Alcohol causes an irregular heartbeat and unstable blood pressure. Directed, did you know? Smokers are 4x more likely to have a stroke. Drinking more than 2 units/day, e.g. 2 beers, increases stroke risk by 34%. Light bulb each day you quit smoking is a day your brain survives longer. 5. Sleep enough and on schedule. Bed sleeping under 6 hours or poor quality sleep increases nighttime BP, heart rhythm issues, and chronic stress. Pushpin sleep isn't just rest. It's the brain's recovery time. Rebuilding brain cells. Hormone balancing. Repairing blood vessels. Direct hit sleep 7 to 8 hours. Avoid screens before bed. Keep room dark and quiet. 6. Train your brain daily. Your brain needs exercise too. Direct hit Cambridge University study. Elderly people who kept their minds active, reading, writing, learning new skills, had 32% lower risk of dementia. Lightbulb ideas. Learn to use a smartphone. Play chess, Sudoku, or puzzles. Listen to podcasts, watch health videos, like your own content. 7. Regular health checkups, especially brain vessel scans if high risk. Calendar if you're over 60 and have a history of high BP, diabetes, high cholesterol, family stroke history. Back and index pointing right, get regular tests for blood lipids, liver and kidney function, ECG, electrocardiogram, Doppler ultrasound, or MRI for brain arteries. Studio microphone, don't wait until memory loss hits. By then, you may not even remember who you are. Open book a story of hope. Mr. Allen, 68, nearly died from a mild stroke 5 years ago. Since then, he quit smoking, walks every evening, learned to use a smartphone to video call his grandkids, gets full health checkups twice a year. Studio microphone, he said, stroke didn't kill me. I killed it with disciplined living. Studio microphone, don't let health be something you only regret after it's gone. The journey to a healthy brain starts today. With every meal, every sleep, every step. Stroke isn't fate. It's the result of unchanging habits and prolonged neglect. Studio microphone. You deserve a life that's healthy, clear-headed, independent. And that starts now. Finally, how to detect and handle a stroke at home. The simplest AZ guide. Studio microphone. Dear viewer, a stroke can strike in your living room while you're having dinner or just when you think it's nothing. And at that moment, the person standing nearby, could be you, decides, will your loved one live a healthy life or it become bedridden for life? Police car lights, stroke warning signs. Remember, fast. A single word could save a life. Input Latin letters, F, face. Play button, ask them to smile. Direct hit, look for one side drooping, crooked mouth, no facial movement on one side. Input Latin letters, 8 arms. Play button, ask them to raise both arms forward. Direct hit, one arm drops or can't be lifted. Input Latin letters, S, speech. Play button, ask them to repeat. I'm fine, everything's okay. Direct hit, slurred, jumbled, incoherent, or no speech. Input Latin letters, T, time. Play button, call emergency services immediately, e.g. 115. Alarm clock, time is brain. Every minute equals 1.9 million brain cells lost. Pushpin, beyond fast. 6 overlooked but critical signs. Sudden unexplained dizziness. Severe thunderclap, headache. Blurry vision, double vision, or vision loss in one eye. Weakness or numbness on one side. Sudden loss of balance or inability to stand. Confusion, memory loss, or disorientation. Direct hit if 2 or more signs appear. Consider a red alert. Direct hit what to do if you spot stroke symptoms. White heavy checkmark step 1. Call 115 immediately. Say clearly, elderly person, suspected stroke. Unconscious/slurred speech/incontinent. Give exact address, patient's name, and how many people are present. Request a paramedic on board if possible. Direct hit, never wait to see if it improves. White heavy checkmark step 2. Record the time of first symptom. Doctors need this golden hour timestamp to decide if TPA can be used. Example, slurred speech at 9:20, write it down. White heavy checkmark step 3. Check breathing, position them properly. If conscious, lay them on their left side with slight head elevation. If unconscious but breathing, also left side to avoid choking on fluids. Do not force water, food, or leave them lying flat. White heavy checkmark step 4. Bring medical records plus med list. Any chronic conditions? Taking blood pressure, diabetes, or heart meds. History of drug allergies? Direct hit, this survival data helps doctors act fast, no guesswork needed. White heavy check mark. Step 5. Stay calm. Avoid chaos. Family panic only stresses the patient more. Do not shake, slap, or pinch limbs to wake them. This may worsen brain damage. Keep warm but avoid thick blankets. May cause heat shock. Fire. Absolutely never do these. Crossmark. Give ginger tea, honey, or herbal medicine. May cause choking and fatal pneumonia within 48 hours. Crossmark. Press acupuncture points or draw blood from fingertips. Not medically effective. Waste precious time. Crossmark. Use medicated oils or scraping therapy. May trigger breathing problems or irregular heartbeat. Direct hit after the emergency. Stroke recovery is a journey. Even if they survive, stroke patients often require physical therapy, speech and cognitive rehab, special diet plans, preventing recurrence, manage hypertension, atrial fibrillation, diabetes. Direct hit recovery demands patience, love, and informed care from the family. Studio microphone. Don't let recovery slip away just because you don't know how to help. Studio microphone. Stroke is a thief that enters without knocking, but you can keep it out if you spot the signs, act fast, respond wisely, print out fast, and stick it to the fridge. Teach it to your parents, your kids, your neighbors. Live fast meaning act quickly to save a life so you don't live in regret. Final message. Every heartbeat is a chance. Don't let it slip away. Sometimes, danger doesn't come with sirens. It starts with a sore shoulder or a strange feeling after waking up. We ignore it, thinking it's nothing, and then someone never wakes up again because a life-saving moment was missed. Studio microphone. If you've listened this far today, you're not just protecting your own health. You're protecting the future of those who love you. Warning, we can't control time, but we can control what we know and how we act. Light bulb. Every piece of knowledge you now have is a shield. Every share you send could be a life saved. Studio microphone. Don't keep this to yourself. Backhand index pointing right. Share this video with your parents, grandparents, and loved ones. Backhand index pointing right. Subscribe for more honest, practical, and life-saving health content. Megaphone and leave a comment if you've ever noticed unusual signs. We're not just here to listen. We're here to learn so we can live longer, live better. Movie camera. Thank you for listening. Stay alert and never trade your life for ignorance.